The second important concept of minimal access surgery is to have triangulation. Now, what I mean by this is that you need to create a working angle or a triangle between your left hand and the right hand instruments. Again, giving you an example of day to day life. Now, whether you are eating with a knife or a fork, whether you are knitting, or whether you are writing or using your laptop and typing with the keyboard, you will find in all these examples the angle between your hands or your instruments which you are going to hold in your hands is automatically around 60 degrees. This is the ideal angle which you should have. Same concept we are going to apply in minimal access surgery also. Why? Because it increases our precision of work. It gives you a better depth perception, something which I'm going to explain in a minute, and it will cause less fatigue and wear and tear to the surgeon. So this angle which is found between your left hand and the right hand instrument is known as the manipulation angle. So it is the angle between your two operating hands or operating instruments. Ideally, during laparoscopy, this angle, which we call as the manipulation angle, should be 60 degrees. Okay. So as it increases beyond 60 degrees, it will lead to, and you can see from this image, if the instruments are further away, the angle increases, and the further apart the two ports or the instruments keep on going, the manipulation angle keeps on increasing, but at the same time, your arms would also be getting more and more abducted. And we all understand this will increase your operative fatigue. What happens if the manipulation angle is less than 60 degrees? Well, now your two instruments will start clashing outside when you are going to operate. And this, how do you decide the manipulation angle of 60 degree? This actually depends on your port position. So where are you going to put your ports? Because the instruments are going to go through these ports. So once you have put your ports, the manipulation angle will be fixed now. So the point here to understand is, it is more important to get your port positions right. Something which I'm going to explain to you in a minute. So along with this manipulation angle, there is another working angle which is very important for us, and this is known as the elevation angle. Elevation angle means the angle between the instrument and the abdominal wall. So ideally, this elevation angle should be around 30 degrees. This is the ideal angle to have your instruments when you're going to do dissections and suturings and knotting anywhere. Again, this elevation angle will depend upon the port position in laparoscopic surgery. In open surgeries, you can keep on changing your elevation angles, isn't it? You are free to move your hands. You can free to move your hands up and down and operate in whatever angle you want. But in laparoscopic surgery, the instrument is going to go through a cannula, which itself is passing through the abdominal wall. So the moment the instrument goes in, you will have a particular elevation angle. So third angle, which is relevant to all laparoscopic surgeons, is what we call as the azimuth angle. This is the angle between the telescope and your hand instrument. So in this image, if you have a look, right in between your left and the right hand instruments, there is a laparoscope or a telescope. Azimuth angle is the angle between any of your instrument and the telescope. So you will have a azimuth angle on the left side and azimuth angle on the right side. Ideally, this angle should be again 30 degrees on each side. So azimuth angle can be adjusted to maintain a manipulation angle of 60 degrees. So what was the manipulation angle? If you remember from the previous slide, it was the angle between your left and right hand instruments. And azimuth angle is the angle between your one instrument and the telescope. So to have an ideal azimuth angle of 30 degrees, you must put the working ports for the instruments 7.5 centimeters on either side of your telescope. This is very important to understand. The moment you have your instruments 7.5 centimeters on either side of the telescope, and I am basically talking about a average size adult patient on which you are going to operate using the standard length of laparoscopic instruments. So for an average adult size patient, the length of the laparoscopic instrument which you are going to use is 36 centimeters. Laparoscopic operating instruments are available in 4 standard lengths. So they come in lengths of 20 centimeter and 28 centimeter. And these you are going to use for your very, very small and slightly bigger pediatric patients. In an average size adult, the instrument length is 36 centimeters. Okay, so using a 36 centimeter long instrument, if you put your working ports 7.5 centimeters on either side of the telescope, automatically your azimuth angle would become 30 degrees, and the two azimuth angles come together to give you the manipulation angle, which automatically will become 60 degrees. Do remember, do not keep increasing the azimuth angle beyond a certain time. So there is a range of 15 to 45 degrees. But as you keep on increasing the azimuth angle more and more and more, mirroring would happen and you will find it very difficult to operate. Mirroring happens when the visual axis and the action axis of your instrument are exactly opposite to each other. This is just a summary of the various angles, the working angles and the triangulation, which is very important in laparoscopic surgery. So here you can see this is the telescope right in the middle. The angle between this hand instrument and the telescope is the azimuth angle of 30 degrees. Similarly, the azimuth on the opposite side also will be 30, so that you get the manipulation angle of 60 degrees here.